Hey, I'm Coley, and this is my medication administration video. So to start off, we're going to list off the 6 rights of medication administration, which are right patient, right drug, right dose, right time, right route, and right documentation. So to start off with administering warfarin, we're going to look at the MAR and the physician's orders, and make sure that they're congruent with each other. So the physician's order states that to administer 2.5 milligrams of warfarin by mouth daily, and the MAR states to administer warfarin 2.5 milligrams of warfarin PO at 1800 each. Okay, so a little bit about warfarin. It acts by inhibiting hepatic synthesis of vitamin K, which inhibits clotting factors. The patient is receiving this medication to reduce the formation of blood clots that may occur due to her atrial fib, hypertension, and type 2 diabetes, as well as her recent surgery. Some side effects of this include bleeding, which is a big one, then petechiae, ecchymosis, hematuria, hematemesis, and tarry stools, which would just be like black or dark red stools. Some lab values to monitor while taking this would be PT and INR. INR, when taking warfarin, should be around 2 to 3, which Ms. Jenkins is 2.2, so those are in normal range. Some other considerations, leafy green vegetables could decrease the effectiveness of this medication. And then also, do not take with aspirin. So now that we've reviewed all the information about warfarin, we're ready to administer to the patient. So before you administer the warfarin, first off you have to wash your hands, and then we're going to introduce ourselves to the patient. So hey, I'm Coley, a SEMO nursing student. And I'm going to be giving you warfarin today. Are you comfortable with where you're sitting right now?
Yes.
Okay. So we may have to elevate your head in order to help the meds go down. Is there any specific way on how you like taking your meds? Like all in one or just one at a time?
All in one.
Okay. So what's your name and date of birth?
Miss Jenkins, January 7th, 1947.
Okay, awesome. Do you have any drug allergies?
Mm-mm.
No. So I noticed that you complained of nausea the other day. Can you grade your pain on a scale of 1 or 0 being no pain and 10 being the worst pain you ever had?
A 3.
A 3? Okay. Has any other side effects occurred besides the nausea? Well, okay. Okay, so warfarin, the medication that you're taking, it acts by inhibiting vitamin K synthesis, which then inhibits clotting factors. You're going to be receiving this medication today because of your atrial fib, your hypertension, your type 2 diabetes, and your recent surgery. So this is going to help you kind of diminish the likelihood of developing a blood clot. So some of the side effects that could happen to you would include like bleeding, petechiae, ecchymosis, which is just like kind of like a bruise with blood under the skin. You could have vomit, blood in your vomit. You could have blood in your urine, and then you could also have tarry stools, which would be like black or dark red stools. So if you have any of those, you would definitely want to call your healthcare provider or your nurse. So some considerations to have while taking this medication. Any leafy green vegetables will decrease the effectiveness of the warfarin. And then also you don't want to take with aspirin. Okay. Do you have any questions about any of those? Okay. So now that we've went through our background of the warfarin and educating the patient about the warfarin, we got the warfarin, and we're gonna do our 3 medication checks. So when we first get the warfarin, we're gonna do a check. We're gonna check the physician's order and the MAR. So the physician's order is 2.5 milligrams by mouth daily, and then the MAR is warfarin 2.5 milligrams PO at 1,800 each night. Okay. So now, when we pour out the warfarin, we're going to do a second check. So we're going to check the same PO and the MAR and make sure that they align again, and they do. And then right before we are going to administer the drug to the patient, we want to do a third and final check. Again, making sure that both align with each other, which again they do. So now we're going to give Miss Jenkins 2.5 milligrams of the warfarin. Here you go, Miss Jenkins. And here's your water. And she's going to take that. Okay. Thank you. Okay, did you have any difficulty swallowing that? Will you open your mouth real quick? Okay, I'm just going to check. Okay, thank you. So now the minister, or the meds were administered, we're pretty much good to go. So we just want to make sure the patient is comfortable before we do leave. So are you comfortable with where you're sitting?
Yep.
And we would give her the call light and all that, and make sure that she's good to go. And then after that, we would document the procedure into the MAR, and then